So I have no way of knowing who's watching this video and whether or not you have any history of self-injury yourself. So I would like to mention that the presentation may include some graphic descriptions, and I would like everyone to take care of themselves as needed as we go through the presentation. So self-injury or self-harm, I thought we would start with a definition. It includes all of the different ways that you can physically hurt yourself. It's done as a means of coping and is not a suicide attempt, although certainly people who self-injure can become suicidal at times. The intention of it is to actually help the person so that they're not attempting to kill themselves. And self-injury falls on a continuum, with some things being more socially acceptable than others, and with that marker switching back and forth depending on the time. So things that used to not be socially acceptable are now more socially acceptable, and so those things vary with year. So some of the more socially acceptable forms of self-harm, smoking certainly would have been more acceptable 20 years ago than it is today, but it is something that's harmful that people are doing that they know isn't good for them and they do anyways. Alcohol use, again, is similar. Piercings and tattoos might fall on those socially acceptable. So tattoos and piercings have become more socially acceptable over the last 10 to 20 years than they would have been, say, in the 60s or the 80s. So everyone has some habit that could be considered to be self-harmful at one time or another. One of the pieces that I find to be most difficult for people is understanding how self-injury could be something that would be helpful to someone. It's a hard thing for people to wrap their brains around because it seems like it's so harmful, and so people have a hard time understanding. So one of the things that I often suggest to people is how many times you get up and start your day with a cup of coffee, even though coffee is a stimulant and may not be the best thing for you, or you eat dessert or you eat too much junk food. Those things are, not good for you, and you know that they're probably not good for you, and yet everyone does them. So if you think of self-injury along that continuum, I think that that will help you to be more understanding. So it's something that is helpful to the person, but isn't, in long term, has negative consequences, certainly. So more traditionally, what we would call self-injury, the main piece that people talk about and use somewhat interchangeably with self-injury or self-harm is cutting. That's using any type of sharp implement to make cuts to the skin. Most people will use razor blades, occasionally X-Acto blades, safety pins. Most people don't traditionally use knives. They're a little bit harder to control the depth of the cuts. So that is something that people often are trying to safety-proof against knives. And most of the self-injurers that I've had an opportunity to work with over the last 20 years or so, most of them don't use knives typically. Burning is also another thing that people do, either using a lighter to burn, or using a cigarette, or using heating up the lighter and then using the top of the metal part of the lighter against the skin makes what they call a smiley face. Burns are particularly concerning because they're a serious infection risk, and besides being obviously scarring. Picking the scabs from the cuts or the burns is something that is considered also to be self-injury. Punching walls is something that is considered to be self-injury. Now, it is somewhat more socially acceptable, particularly if we're talking about boys. So a strong emotional reaction, somebody punches a wall, causes physical harm that reduces that emotional reaction. So it serves the same function. And it certainly can be very, very damaging if they happen to hit a stud on the wall, break some bones, those types of things, but often ends up with some scrapes along the knuckles. Hair pulling, and some people consider it to be an obsessive compulsive symptom, some people consider it to be part of a self-injury symptom. It has a self-soothing kind of quality to it, so it's perhaps a little less harmful if you're only pulling a few pieces of hair, but if you're pulling half of your head, that's a slightly different issue. Head banging can be considered to be a form of self-injury. Drug overdose we consider to be a form of self-injury. And most people that self-injure use multiple different choices. So they're trying and doing different things at different points in time. So the current estimates of self-injury, current research is suggesting that between 7.5% and 17% of adolescents are participating in activities that are considered to be self-injurious. And that comes from a couple of research articles from 2008, so those aren't extraordinarily recent, but it's a very difficult topic to get accurate measurements of because it's hard to get people to participate in studies and admit to it unless they're actually involved in some form of treatment. So it is a significant number of adolescents that are participating in things that can be considered to be self-injury. In the past, youth who made cuts to their arms, they would need to be covered by long sleeves, and so that's something that would often tip off our positive influencers, right? Parents and teachers, soccer coaches, all of the people we're trying to target in this video. The long sleeves or wearing long pants in the summertime might be something that would tip people off. Certainly within the last 5 to 10 years, we've been seeing people doing more cuts on their stomach or their hips or their legs, places that are much less obvious and much less noticeable. And certainly that is creating difficulties in terms of people being able to identify or make a guess that someone might be self-injuring. So many of these cases go unnoticed. I have lots of people that I've dealt with who have self-injured for years before they get to me, and that it makes it much more difficult to manage their behavior and help to change their behavior when it's become something that's been so entrenched. So the big question that people always want to ask is why? Why do people do this? It seems so painful and so hurtful, and I don't understand how it could help somebody. And so I think that this is a really important piece for us to talk about. And of course the answer is that it's very complicated. In general, the best way to think about it is that self-harm is a coping strategy. Like I said, much like somebody who comes home from a rough day at work and has a beer, or gets frustrated and eats a bunch of junk food, those kinds of things, the same kind of continuum. So self-injury is something that is harmful, but it's very effective in the short term. In the short term, it makes them feel much better, much quicker than some other coping strategies. But in the long term, it has very significant effects. So usually there is some kind of intense emotion that the person feels that they can't handle. So that could be anger, it could be frustration, it could be sadness and depression, it could be self-loathing, that they feel like they should be punished for something that they weren't good enough. And the self-injury is a response and an attempt to manage that behavior. It can be a way to show people how much they hurt on the inside, but it isn't really attention seeking, because most of the people who are self-injuring are hiding this. So certainly it's a way to show people suffering for the people that they choose to share the information with, but for most of them it's not really attention seeking, and typically the attention that they get from this is not the kind of attention that most people are seeking. I've suggested if you want some attention, you can dye your hair blue, or do something much more creative for attention than cutting yourself. It usually does not end up with the right kind of responses from people. Some people will say that it can be a way to feel real and alive, that they feel like their life is fake. It's like a movie, and nothing feels real. So the self-injury has been reported by some people as a way to feel real. It can be a way to feel in control, which seems a bit odd because it's perceived as sort of being out of control and something that they have to do. But when the rest of their life feels out of control, this is something that no one can take from them, and it's theirs. Usually self-injury makes the person feel better initially. If they don't feel better, typically they don't do this again if it's not functional and not helpful for them. But they often begin to feel guilty or regret the action, which creates a loop of self-injury. So what happens is they self-injure, they feel better momentarily, and then it starts to build. I can't believe I did that again. I told so-and-so I wouldn't do it, or now I'm going to have cuts and I have to go to prom, or I need to be able to wear a swimsuit, or I need to be able to do these things, or somebody's going to find out. And then they start to feel worse again, and that causes another self-injury episode because they're having difficulty managing those strong feelings. So it is very cyclical. So if we look at things for what to watch for, so in the youth that you're seeing and the youth that you're dealing with, what are some of the things you want to keep an eye out for? So certainly sadness and depression is a factor. Anxiety is a factor. The one that is typically not seen as a factor is perfectionistic tendencies. So sometimes we have youth who seem very well functioning. They get very good grades, they play a lot of sports, they belong to clubs and teams, they might sit on student council, they're involved in organizing things at their school. They appear very happy and very well functioning, but because of these perfectionistic tendencies, they're never good enough, and they're always sort of beating themselves up, both figuratively and literally, in terms of not feeling good enough. So those perfectionistic tendencies, really high achiever kids can also be at risk. Anger is certainly a major factor for a lot of people, as we were talking about earlier with the wall punching, for example. And people who have traumatic histories. So trauma does certainly perpetuate or create an opportunity for self-injury to occur. If we look at the risk factors, what are the types of things that place people at higher risk? Not to say that necessarily any of these things would necessarily precipitate a self-injury behavior in a youth, but just things that we want to be paying attention to. When you're seeing these types of patterns of behavior, you want to be asking the right kinds of questions and looking at the right things. So poor coping skills are certainly a large piece of what we have. They are relying on the self-injury to help them to manage strong emotions and don't know how else to manage those strong emotions. So certainly teaching coping skills and helping people develop a wide variety of coping skills to use to deal with strong emotions is very helpful. Youth who have limited social supports and feel somewhat isolated and alone, that certainly is a risk factor. Family members who suffer from depression, so modeling of behavior that doesn't help them to manage those strong emotions can be a risk factor. Bullying and peer conflicts at school are certainly a risk factor. Conflicts with boyfriends or girlfriends are very significant issues. They're usually very dramatic, big deals that happens on any given day and create a lot of really strong emotions and difficulties managing those emotions. Any kind of increase in conflicts in family life, and that can be any variety of conflicts, from parents who are critical right up to, abusive home environment. Youth who have a history of abuse or neglect are also at risk to develop self-injury. And anyone who's had childhood illness or surgery. And this is an odd one that people don't often expect, but there's something about have a significant childhood illness that creates a world that allows you to feel a little bit out of control, that things happen to you and you can't do anything about it. And so that is also a precursor, a risk factor to consider. And the more of these risk factors that people get, the higher the chance that self-injury could be one of the symptoms that they present with. So anger, guilt, or shame is another significant risk factor. Learning disabilities, the ability to problem solve around things. Chronic illness certainly creates a hopeless quality where you're sick all the time or you're having to see doctors a lot. It's hard for people to feel in control of their life. Loss of a family member through death or divorce is a significant risk factor. Having an absentee parent for whatever reason. So parents get separated or divorced, they don't have contact with one parent, a parent dies, certainly is a major factor. So anytime there's an absentee parent, we often have children who are placed into foster care and removed from their parents, and even though that might be the best thing for them because their parents weren't able to manage them at that point in time or be able to be as supportive and helpful for them, it's still very difficult always for a child to deal with not having their parent around and not having their parent be the kind of person that they're wanting and wishing and desiring for that parent to be. Stressful or traumatic events and substance abuse issues are also significant risk factors. Substance abuse issues because that's already a negative coping strategy, as a form of self-injury, if you will. And as I've talked about, feeling out of control and the high need for achievement or perfectionism is also an important factor to consider as a risk factor, which is not one that people typically think of or typically see as being part of this profile. And humiliation or rejection, it holds an enormous amount of risk. So if we look at, in addition to the risk factors, it's important, I think, to consider also the protective factors. So it's important to consider what might be something that would help to protect or prevent this from developing. So one of the things, the key pieces of information that we know is one healthy adult that the teen feels close to can make a world of difference. So that healthy adult does not have to be a parent or a grandparent. It can be a teacher, it can be a soccer coach, it can be a music teacher, gymnastics coach, Girl Guides leader, but one healthy adult that the teen feels close to can make a world of difference in terms of feeling heard, feeling listened, feeling empowered. Open communication within the family, so an ability to talk about things that are difficult, where we have families who don't want to hear about the problems, or where parents and other family members are not able to hear about the problems because they become emotionally distressed when they hear about difficulties. That causes the youth to shut down and then not be able to rely on adults to help them manage those strong feelings. So open communication and a line of communication that allows them to talk openly with other family members is a really important piece. Supportive friends and having social activities, having fun things is a helpful piece. A willingness to seek help is always a protective factor. So if the sooner we find out about difficulties that are happening, the easier it is for people to make those changes. So when something has been happening since they were 8 years old, and they're not 16 until they're getting help, that's much more difficult to deal with than if that 8-year-old had somebody who found out and got some help at 8. Creative problem-solving skills. So people who are able to think outside the box in terms of how they can manage their life and the difficulties that come with it. The more creative that they can be about that, the more open they are to trying new things and doing different things is very protective. So having experience with success. We have a lot of children who have never felt that they were really in control of what was going on, that they were the best or really good at something and had that kind of self-esteem built in. So having experience with success in any area, being a good artist, being a comedian, being athletic, in addition to having academic achievement success, any of those kinds of things are protective factors. Having an optimistic outlook, really believing that things are going to get better, is a lot of these kids feel very hopeless. They feel very stuck, that they were where they are where they are, and that there isn't anything that's ever going to get better. And so if you believe that nothing is ever going to get better and you're going to continue suffering for a very long period of time, it's very hard to be motivated to try something new if you don't think it's going to help and it's not going to work. So an optimistic outlook is really important as a protective factor, not only to help them get better if this were to become a problem, but also to prevent it in the first place. So the hopefulness, the optimistic outlook. And good self-esteem, right? Feeling positive about yourself is an important factor as well. So I often have a lot of people who say, well, what about copycats? Because we have a whole bunch of kids at our school who are all self-injuring. And the reality of it is that most people will hear about self-injury somewhere. So you're watching this video, you're going to see a television drama that talks about it. And it's been something that's been around since, it's been talked about on television, 90210 back in the 80s and 90s had episodes on it. So there's lots of opportunity for people to hear about it. It's in music videos, it's in other peers are talking about it. So the information is out there. So having these conversations is not going to cause anyone to self-injure. So if you ask somebody if they've ever done this or if they've ever thought about it, their response isn't going to be, oh, gee, I never thought about that before, but let me go cut myself and try it. So we're not going to be able to suggest it to them. But there are certainly some people who pick it up from other kids because they're talking with their peers, and they're saying that this is really helpful for me and it's something that I find to be useful, and so they will try it. But if it doesn't work for them, if it doesn't help dramatically manage their emotions, which for most of us, self-injury wouldn't. If I was really upset about something and I cut my hand, this would not help me to feel better. It would make me feel worse. So a lot of people, they might try it once, but if it doesn't work, they don't do it again. So don't be concerned about that you're going to suggest or give them an idea about self-injury or about suicidal thinking or any number of different mental health issues. They've already heard about it. You're not going to be talking about something that they don't know. So one of the things that we know is youth often feel tremendous pressure to succeed at school, at home, and in social settings, but they lack the life experience and the coping skills to know that difficult situations will not last forever. Their lifetime is relatively very short. If we're talking about someone who's only 12 years of age, it's only, maybe a 15th of their lifetime. And so there's a whole lot of learning that just simply hasn't happened yet, and their brains haven't completely developed in order to be able to do all of the, creative problem solving that adults can.